Hi, my name is Darby Steinman, and I'm going to be doing my presentation on my rotation project, which is CTC culture enabled by capturing CTC heterogeneity using a PDMS-Gold microfluidic device with glutathione-controlled gentle cell release. So jumping into some background, cancer is one of the leading causes of death in the United States, and this is primarily due to cancer metastasis. And this is caused by the presence of circulating tumor cells, or CTCs, which are free-floating cancer cells found in the vasculature, which can then find a secondary site to begin to proliferate and then cause the presence of another tumor. So the primary reason that we care about CTCs is by capturing them from a whole blood sample can lead to the diagnosis of cancer and possible metastasis. And this is especially important for early stages of cancer where a tumor might not be present yet. So being able to determine the presence of these CTCs could lead to earlier diagnosis. Additionally, being able to test for cancer through a blood sample is much more non-invasive, less expensive, and less painful for patients. So the two most common cancer surface markers are EpCAM and CD44, which are used for cellular adhesion, cell proliferation, and also for promoting migration. And since these are much more prevalent in cancer cells than in normal cells, a combination of the both of them can be used to maximize the capture of these cells from a whole blood sample. So talking about the existing device that a lot of my work has been based off of, we have the VISA chip, which is a PDMS microfluidics device that has a titanium and a gold coating for facilitating antibody binding, which has over 3,000 100 micrometer posts that are going to contain those antibodies so that when a whole blood sample flows through them, the CTCs will be able to bind and be separated from the whole blood sample. Additionally, with the presence of these two electrodes, an electric field can be applied to create a dielectrophoresis force, which is going to move cells away from the high velocity areas into the more low velocity areas that also have a higher electric field. So looking at this picture down here, if the flow is straight through these channels here, then the higher electric fields are going to be in between these posts here. So that's where most of the CTCs are going to bind. So the addition of EpCAM and CD44 is uses a thiol gold conjunction. So you can see in the top image here, using PEG, the antibodies are captured onto or stuck onto the gold. And then once the whole blood sample has been run through the device and the CTCs have been captured and all the other cells washed out, the CTCs can be released using a ligand exchange reaction, which is facilitated by glutathione. So when glutathione is added, it and gold are going to create a sulfide bond, as you can see here, which is going to go ahead and release the antibodies, which are also going to release any cells that those are bound to. So my current work incorporates the need for less electrical components. So this is to reduce the cost of the device, but also to allow for use of the device in lower income areas. So a lot of places are not going to have access to amplifiers or generators. So the need for a device that maintains the efficacy of binding the CTCs without the use of electronics is needed. So as you can see here, as I mentioned earlier, the flow is going to pass through these channels in the current device that we have, but in the prototype, the flow is going to have to wrap around the posts, which is going to increase the chances of the CTCs to bind to the antibodies. So as you can see here, this is an example of a flow study that I've been running. Based on this live stain, you can see that we do show that there is capture of the CTCs. I've been using MCF7 specifically, which is a breast cancer cell. So this does show that based on preliminary data, we should be able to maintain the efficiency of the previous device. And I'd just like to thank my PI, Dr. He, as well as Dr. Ali Kuzira, the postdoc, who's accomplished a lot of the work that I'm currently finishing. Thank you.